Welcome, everyone, to another special edition of the Living Transplant Podcast. This week, I am bringing you behind the scenes at the Banff CST conference to introduce you to some incredible people who are presenting all about their innovation and exciting ideas about transplant and how to make this journey much better for potential recipients, donors, caregivers, families, and patients in the system as a whole. Thank you so much for joining me this week. I'm very excited to bring you different episodes throughout the Banff CST conference, so stay tuned for more. Today, I am joined by Dr. Caroline Tait, who is presenting about debating presumed consent legislation and why engagement of First Nations, Métis, and Inuit health leaders are key to decision-making. Welcome, Dr. Tait.
I'm Dr. Caroline Tait. I am the research lead of the First Nations and Métis Organ Donation and Transplantation Network. It's based in Saskatchewan. I am a professor in the Department of Psychiatry at the University of Saskatchewan, but moving in January 2023 to the University of Calgary to become a Canada Research Chair focused on inequities in Indigenous health.
Wow, fantastic.
Yeah, I'm excited.
That's amazing. And so you are here at Banff CST. I'm wondering if you could talk a little bit about the presentation that you'll be doing.
Yeah, I'm really excited about the presentation because I think what the presentation will do is that it will draw attention to issues for Indigenous people that maybe others haven't thought about.
Mm-hmm.
So the main focus of the presentation begins with Nova Scotia and the Nova Scotia government, which has passed deemed consent legislation, but did not consult with Indigenous peoples prior to the legislation. So what does that mean? And so in the talk, I refer to what we call free and informed consent. And with Indigenous peoples in Canada, that the government does not have a duty to consult on legislation, on health legislation with Indigenous peoples. There's no legal reason that the governments have to consult with Indigenous peoples. But part of good government and good policy is really to engage Indigenous peoples. But if you look at the UN Declaration on the Rights of Indigenous Peoples, it clearly states in Article 19 that consultation should be done. And so I refer in my talk to the rights of Indigenous peoples, really trying to make a distinction between the ways in which many governments and medical health-related issues are seen, that Indigenous people are an ethnic group, or they're a vulnerable group, or they're a group, a marginal group, and there's all kinds of language that's used.
Mm-hmm.
But first and foremost, Indigenous nations, First Nations, Métis nations, Inuit nations are nations, and they hold rights and they hold certain sovereignty over what happens to their people.
Mm-hmm.
And certainly in research, we have a lot of discussion and have for years around data sovereignty.
Mm-hmm.
And this applies as well as we move forward and we start to look at the development of policy and legislation.
Mm-hmm.
And so the talk that I'm giving, first of all, draws upon that. The second thing that it does is that it talks about where are Indigenous people in the organ donation and transplantation discussion.
Right.
So they're basically absent, although there's some very good researchers, Dr. Jag Gill and Dr. Aviva Goldberg and others that have been working in this area. Again, their research is just in the infancy in some ways. I think they would agree with me that, they're doing their best to look at what are the barriers, what are the gaps, how do Indigenous people understand organ donation and transplantation. So even globally, there's very little literature. So that's a real challenge. But I draw attention to the disparities. And so what we have is we have geography, of course, as being a main challenge, where people live, how they access services. And I can't remember the name of the author, but there's an article that I've quoted where the author points out something so important, that where you live is the center of your universe. That's
right.
What's normal.
Mm-hmm.
So if the North is normal, then we need to start thinking about patient-centered care in the North, not
right.
patient-centered care from this distance, and what we have with transplant programs is that they're largely, urban-based, big urban centers, and there's a shortage of organs. So if there's a shortage of organs and your work is in a big urban center, it's really difficult to be concerned about people in remote regions and all the challenges that they face. So,
Right.
so that does not mean that Indigenous people in northern and remote regions do not receive transplants. They do. And the people that I've talked to in Saskatchewan that have received transplants have really not many negative things to say about their journey. But most of these individuals were people who are employed. They're people who are better off in our communities.
Right.
So we don't know, and that's where there's this huge data gap. So we don't know right now how many people who are Indigenous require a transplant. We don't know how many people are being placed on the transplant list, and more importantly, how many are not being placed on the transplant list and the reasons why. We don't know whether Indigenous people are receiving transplants the same as everybody else, or whether there's certain gaps. So I wrote a paper that was came out in the Circumpolar Journal, the International Journal of Circumpolar Health in 2022. That talks about the intersection of utility and equity. And so this is really important when we're talking about deemed consent legislation.
Right.
So what we have with deemed consent legislation is a couple things, and I won't go into any more detail about the equity and utility, but I'll try to pull it into why it's important in the time we have. So if we're looking at organ donation and transplantation, we don't have a lot of information about the ways in which about the barriers that exist. And so but when it comes to organ donation, there are a few things that we know. We know that Indigenous people tend not to be organ donors, and that's for a lot of reasons. And the one thing is that to be an organ donor when you live in a remote region, I mean, there's a lot of things have to happen for you to be able to be a donor, right? So you have to be in a southern hospital, you have to be, certain conditions need to happen. So there's certainly some of that, but there are cultural issues, although the cultural issues in the literature, at least, and in my discussions with people, and I discuss with people every day in our communities about what they think. So it's not research data, but just in informal conversations, I'm always raising the question of, have you ever considered to be an organ donor? What do you think about organ donation? And there's a real mix from people coming back where there's people who feel very strongly that if I sign my organ donor card, if they know that I want to be an organ donor and I come into the hospital and I'm in an emergency place, that I may not be given the life-saving care that I need, because they want my organs. Now, transplant people in transplant programs will argue, okay, that's not the way it happens. But regardless of the way that it happens, if people perceive this to be an issue, and so why is it that they would perceive it to be an issue? Well, it's because of history. It's because that there's times where the government, the church, the healthcare system, and we just saw, the example of Joyce Echaquan in Quebec and Brian Sinclair, in Winnipeg, 2 cases where people, avert racism, and so we know that it happens, and so not to say that the system is entirely racist. That's not what I'm saying, but racism does occur, but also the perception of racism is just as important. So if you have people who perceive an unsafe healthcare environment, well, of course, organ donation, taking your organs, it's not surprising that people would be really hesitant to sign their donor card or to become to notify people to become an organ donor. So that's one thing. The second thing is goes back to that equity and utility question. And so if we have, are we looking at the legislation through an equity lens? And if we're not, what could happen? So is there the risk, and this is, I think, the most salient point of the talk is there a risk that we will end up with more Indigenous people through deemed consent becoming organ donors? But if we don't address the equity issues, that there won't be an increase in the number of Indigenous people receiving organs.
Right.
Because unless the equity issues are addressed, Indigenous people will continue to be excluded from transplant lists because of non-compliance, right? Essentially, non-compliance, and non-compliance is very interesting because it sounds like it's something intentional by the patient.
Right.
But non-compliance can be that you get stuck in two storms in which you miss 2 appointments and you can't get to your appointment. So from the point of view of someone who's deciding who should get an organ over other people, because there's a shortage, that decision always is to be made. Are you going to choose the person who post-operative might not be able to adhere to the regime after the operation, or who haven't been able to make the appointments? So I don't think that any of these are easy decisions or easy considerations. But what we really need in the context that we're working is to try to find ways to better collect data so we can actually answer those questions that I outlined, because without answering those questions, even in terms of racism, so I can argue that there's racism in the system. And if somebody says to me, show me there's racism in organ donation and transplantation, I actually can't show that to you. I could show you maybe a case study or 2 of people who felt that they experienced racism. But one of the ways that you can look to see if there's a bias within the system that is based upon the identity of the person being Indigenous is to break down Inuit, Métis, and First Nations and look to see who is being placed on transplant lists, right? So it appears that when Indigenous people are on transplant lists, they receive transplants at the relatively, they maybe not as frequently as other people, but that they are receiving transplants. So that brings us then to the question of, what about the people who don't make it on the transplant list? What happened to them? Why weren't they placed on the transplant list? So I think the deemed consent legislation, that equity piece where we could see more Indigenous people as organ donors, but fewer receiving, right? And then the other thing is just general trust in the system. So what happens if Indigenous people decide that they want to push back against this, that they would prefer for an opt-in rather than an opt-out system? And does an opt-in system or an opt-out system, a deemed consent system, in terms of free and informed consent? So if provinces start like Nova Scotia to implement this without proper consultation, then what you have is you have a breach of this free and informed consent according to Article 19. Now, I may be over exaggerating. Of course, it would have to be sorted out through legal people who would know, but just on face value, it looks like it's a valued argument. And so in that way, you may have this backlash towards transplantation that may in fact have the opposite effect of what we want, which is we want more Indigenous people to want to become organ donors. We want more Indigenous people to receive organs. And that maybe with, maybe with consultation and inclusion of Indigenous people in the deemed consent legislation discussion, that then we could look at it through the equity lens to make sure that the legislation includes certain considerations around equity that I don't believe are there right now.
Wow. That's a lot to think about. Wow, thank you so much. And so thinking about this, I feel like we could do a 4-hour podcast on this episode or this issue alone. And I will definitely be asking you to join us on a full-length podcast. So look for that email. But I'm wondering, people who are listening today who, want more information about what you're talking about today, and then all of the things that you've brought up, is there, a place where we can find the publications that you spoke about? Or if somebody is just generally interested in what you've talked about, where can they get more information?
Yeah, so the deemed consent paper it's been through peer review, and it's been accepted with revisions. So it's in the stage of the journal looking at the revisions. So I assume it will be published, but I don't want to jump the gun on it. But it would be coming out in the Lancet America. So there's different Lancet journals, and this one is in the Americas. So, and it was very positively reviewed. So I think that's important. The other article is in the Circumpolar Health Journal, which looks at utility and equity and all of those issues, and again points to the ways in which through the system Indigenous people can be disadvantaged. And then, of course, as I said, there's the work of Jay Gill and Aviva Goldberg and others. There's this emerging literature, but also I think if people are interested to look at the kidney literature, so not necessarily the organ donation and transplantation literature, but a lot of the kidney literature really speaks to those issues, right? Speaks to the issues of barriers to care and gaps in services.
Fantastic. Thank you so much. I really appreciate your time and letting me snag you between sessions. So thank you so much. That's amazing.